not one of the co-founders of On the Count.
Okay.
I have picked up the baton that has been started by brothers like Joseph Jazz Hayden and Ed Ellis, who were actually the original founders and hosts and producers of the show. I'm just a student of them. So I definitely want to preface whatever I say today by saying that I am a student of the non-traditional approach of criminal and social justice. I have been a student of the non-traditional approach since approximately 1997, which is when I first was introduced into this package and into this work. I'm not going to talk too much about that, but Brother Lukman is one of the authors of this package as well, and of this study, which out of that, it was actually born of the 1971 Attica Rebellion and the think tank that was born from that. So I'm also an extension of that. And so I'm here doing the work that I do around HIV and with the radio station because of that foundation and because of my being blessed to be introduced to some exceptional people and wanting to be willing to push this movement forward. And so I'm just a humble servant in that way. So I served 14 years in prison from the age of 20 to the age of 34. And during that time frame, I definitely became a part of different movements and struggles and organizing. I learned to write, I learned to speak, I learned to try to figure out what it was that I wanted to do. I really didn't know what I wanted to do when I came home, but I had interest. I knew that I was going to be someone involved in struggle and in movement. And I was introduced to some people that were doing work around HIV and AIDS, and I got involved with the program back in 1996, 1997, and as soon as I got involved in the program of PACE, the PACE program, for those that don't know, PACE is an acronym. It stands for the Prisoners AIDS Counseling and Education Program. And so this is where the men, because the women have their own HIV programs, which are a little bit different but similar, but these are the programs that exist within the New York State prison systems where someone can go and learn about HIV and AIDS, learn about hepatitis C. Someone who is HIV positive is able to go and get the kind of support that they need, support groups, educational groups. So I became involved in that and became a facilitator in that just a few months after. I realized that I had an interest in this. I have a very close friend of mine who is a longtime survivor of HIV, and so he definitely inspires me to be involved in this work. And so from then on, I never looked back. So around 2001, I was already involved. I was at Otisville. I was already involved in HIV. I was already involved in organizing and all of this stuff. And I finally sat down for an HIV 101 course, right? Because I needed the certificate. Not that I needed it, but you know, I just wanted to be involved. And they said, okay, you need to have the certificate in order for you to be a facilitator, blah, 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 whatever. So I did that. And I'm sharing that with you because just to say that I have met some really wonderful people who have taught me about HIV and AIDS, and I have to shout them out. So the facilitator of that group at that time, this was 2001, I still have that certificate, by the way, in my house. The brother's name was Fletcher. I don't know how many know Fletcher. Fletcher was an old timer as well. Did a lot of time as well. And Fletcher taught the course. Shortly after that, Fletcher passed away. So, yeah, I'm here representing him as well. So I was released in 2006, almost 9.5 years ago. So I'll be celebrating 10 years this year. And I have 2 weeks after I was released, I went for an interview at Help PSI. How many of have heard of PSI, Project Samaritan Inc.? They're one of the community-based organizations that provide all kinds of services: mental health, substance abuse, housing, but especially HIV. So 3 weeks after I was home, I sat in this interview, and I went in there just to get an entry-level job. I'm like, listen, I'm coming in to do entry-level work. It doesn't matter. My background and foundation is PACE. So I knew HIV. I know HIV. I know Hep C. I was involved with that part for many years. So when the interview was over, the brother said, you know what? No, I'm not going to give you an entry-level job. I'm going to give you a CMT position. You're going to be a billable staff. Mind you, just came home from doing 14 years in prison. But it was a blessing because I have not looked back. I've been involved as an advocate and activist, health educator. I've done so many, in the past 9.5 years, I've done so many trainings, and not to boast, but just to say you have to stay on top of stuff. So I'm standing before you an expert when it comes to HIV and AIDS and activists. Yes. So those of you guys know there is a difference between HIVs, there's a difference between HIV and AIDS, the virus that causes AIDS. The CDC defines it. So we all know that in New York State, if a person is HIV positive, by law, whether or not they have insurance, they have, by right, they can apply for ADAP and be covered for their medications and their doctor's visits. You guys know that this is in existence. So this is one of the services that exist with, for people who are HIV positive. So I have been blessed to work as a case manager, an advocate, a health educator for the population. And obviously, when I meet someone, and this is across the board generally, anyone involved in who's HIV positive, I work as an advocate for. And mind you, I'm a student of the non-traditional approach. So I'm looking at this from a whole different perspective. And I don't have to tell you that if we were to put a map of the United States on one side depicting poverty rates across the United States on one side, then we put on the other side a map with the United States and showing HIV and AIDS populations, guess what? They can almost match. Because poverty is one of the top most contributing factors to poor health. Obvious. I'm a victim of that. I grew up poor, hardly ever went to the doctor. And that's speaking on the eye, and that's just how we've grown up. It's still a reality today. In New York State, people are coming home, HIV positive, there are services for them, but guess what? The overwhelming, those who are identified, let's say, right now the numbers are, in New York State, anywhere upwards of 1,500 people are HIV positive throughout the New York State prison system. But that is not everyone, because if you know the numbers and you studied the cascade and all of that, there's always about 25% or more of people who don't even know their status, right? On top of that, there's people who are in the New York State prison system who are not sharing their status because of stigma and discrimination and lack of confidentiality within the system, and poor medical care within the system. It's a reality. We have, approximately 54 prisons across the New York State, right? There is no uniform transitional, I want to say pre-release because I'm come from that, but pre-release transition, there is no uniform transitional service system that says, come here, we will help you with your diagnosis and connect you to treatment and then have that process again to connect you outside. It doesn't exist. I spoke at the World AIDS Day event at Walk Hill, and it's one of the few places where they're actually connected with some CBOs, but it's not multiplied. So, how much time? So I haven't even spoken about Hep C, but so there are services that exist for the HIV population. There are services for someone who is Hep C, but it's not the way that it should be. We need more people who are formerly incarcerated to be involved in this kind of work. And I'm always telling people that whenever I go to speak, I'm like, listen, if you have a transitional service program, if you have a health care program and you're working with these people in their transition, doing the reintegration, you need us there at the table. We need to be a part of the leadership. Right. With respect to hepatitis C, there's more people with Hep C in New York State prison systems than there is with HIV. There's more people dying from Hep C yearly than there are from HIV. Hep C has always been the silent killer that people were not even talking about or diagnosed with. And today there's been a lot of inroads with regards to treatment. And I'm gonna finish and end with that there are services and there are people in my position and others who are doing this work. And I've made my career in HIV and AIDS. I'm not, my career, my 9 to 5 is not reentry, reintegration, criminal justice. That's my life. And that's my work and my volunteer work on the count. But my 9 to 5 is HIV and AIDS and hepatitis C, and there are services there. But the problem is, it's not enough. It's not enough, and there's not enough of us or you. So those of you who are here, this is a call for you as well to get involved. Learn more about the viruses, learn more about the treatment and services, and get involved. Thank you.